From Wish TV and Community Health Network, this is a Health Spotlight Town Hall Special.
Good evening, everyone, and thank you for joining us for this Health Spotlight special. I'm Phil Sanchez. We're proud to partner with Community Health Network to talk about critical health issues right here in Central Indiana. Tonight, we want to focus our attention on women's health. That includes menopause, preventative screenings, and minimally invasive surgery options. But first, with tomorrow marking the start of Breast Cancer Awareness Month, we want to take a closer look at the disease. News 8's Malia Van Ostrand has more.
Thank you, Phil. I'm joined by Dr. Claire Edelman. Thank you for joining me today.
You bet.
Yeah. So when should women begin regular mammogram screenings, and how often should they do that?
You would think this would be a very simple answer, but unfortunately, like a lot of things in medicine, it's not. And it really depends on each individual patient's personal risk factors and their family history of breast cancer. But for a patient who's overall has a low risk of breast cancer, the recommendation by the American College of Obstetricians and Gynecologists is that they begin annual or yearly screening at age 40.
What are the latest advancements in breast cancer screenings?
We've had some recent advancements, mostly in the area of digital mammography that provides better images and detects breast cancer earlier. We also have recently been incorporating breast MRIs into our screening recommendations, and that's for patients who have higher risk of breast cancer. So for them, we'll often recommend that they alternate a normal mammogram with a breast MRI every 6 months.
How does family history impact these screening recommendations?
Yeah, family history is huge. It really helps guide when we recommend patients start getting screening. So for example, for a patient who has a first-degree relative, which is usually a sibling or a parent who has had breast cancer before the age of 50, we would recommend that that patient start screening 10 years before their relative was diagnosed. So if my mom was diagnosed with breast cancer at the age of 45, for example, the recommendation would be that I start screening at age 35.
What are things that women can do to advocate for their breast health?
Yeah, the biggest thing is knowing one's family history. So be asking family members, what has happened in the history of our family, and coming in with that information is really key. And then talking with your provider about whether they should get genetic testing. We've come a long way in the area of genetic testing for breast cancer. There are those common genetic causes of breast cancer that people are aware of, like BRCA or BRCA, but there are many more that we continue to discover. And so talking with your provider about whether you qualify or should be screened for genetic causes of breast cancer is also huge. And then knowing one's own breasts, being aware of changes in one's breasts. We no longer recommend self-breast exams, actually. That's kind of a recent change. We talk about breast self-awareness. So no longer every shower do you need to do a self-breast check, but we recommend just knowing whether they've changed in size and color and shape, whether you have a different sensation or feeling, and then coming to your provider with that for an annual, at least every year, getting a breast exam by a provider.
Can you talk more about the signs that people should look out for physically?
Yeah, there could be changes in color. There could be kind of firmness or pain. There could be the change in production of like discharge from the nipple even. Kind of just any little bump or different sensation should be taken seriously.
Is there anything else that you think is very important for women to know about their breast health?
I just think we are noticing that breast cancer, we know breast cancer is really, really common, and we're noticing that it's being diagnosed earlier and earlier. So I think having a good relationship with your provider, making a plan at an early stage, these are all really important.
All right. Thank you so much for joining me today, Dr. Edelman.
Yeah, you bet. Happy to be here.
If you're struggling with menopause symptoms, you aren't alone. The treatment options that are available to you.
Locally owned, locally operated, local news. Wish TV.
All right, welcome back. Let's continue our women's health conversation with Dr. Candace Westgate. Doctor, good to see you. Thank you so much for joining us.
You're welcome. Thank you so much for having me tonight.
Let's talk about menopause. First, the symptoms. What are some of the most common symptoms, doctor?
Absolutely. Unfortunately, there are so many symptoms. The most common that most people know and understand are those bothersome hot flashes and night sweats. But because there is an estrogen receptor just in about every single organ within a woman's body, symptoms are vast. And so a lot of women experience joint pain, vaginal dryness, changes in their urination frequency, urgency, nighttime urination. Another big symptom that a lot of women get, which can be very confusing, is mental health changes, increasing anxiety, increase in depression, brain fog, searching for noun kind of words, which leaves women very confused and oftentimes very scared, not understanding the changes that are going on in their bodies.
Why does that happen? The mental health side of it?
Because our sex hormones are actually precursors to the neurotransmitters within our brain. And there are many different places in our brain that have estrogen and progesterone kind of receptors on that. So one of the biggest areas is that thermostat in our brain, and so that's where the hot flashes and the night sweats come in. Another big symptom for women is sleep disturbances. So irrespective of getting up to use the restroom or irrespective of waking up because of night sweats or heat, sleep is significantly disturbed during this menopause transition. At the beginning, there's this thing called perimenopause. And this is about a 5 to 7 year time frame that takes place before the quintessential last menstrual period, right? The definition of menopause means a woman's gone for a full 12 months without a menstrual cycle or hasn't ovulated for 12 months. But the years leading up to that can be as confusing, as symptom heavy because of hormone dysregulation during that phase.
Right.
The menopause transition and on, the symptoms are because of low estrogen and hormone state during that phase.
What would you recommend for women going through either one of these?
Yeah, I would recommend, number one, get yourself educated on what internally is going on in your body, what these hormone changes are causing, what symptoms they're experiencing. Now, just like each of our fingerprints, a woman's menopause and perimenopause experience is going to be very unique. And so one woman's symptoms are not going to equal another woman's symptoms. But understanding the complexity of this, finding a trusted healthcare provider who can guide you through different treatment options, help you to stay healthy during this process and not confused and despondent.
Yeah. Dr. Westgate, good to see you. Great conversation. Thank you so much for stopping by.
You're welcome. Thank you for having me.
Absolutely. News 8's Gina Galeros is with Dr. Michelle Murphy and has more on menopause treatment options.
Thanks, Phil. Dr. Murphy, thank you for coming in today.
Hello, thanks for having me.
What treatment options are available for menopause, both hormonal and non-hormonal?
Well, that's a great question. We do have hormones that we've had for years that are very effective in treating hot flashes, vaginal dryness, painful intercourse. They're FDA approved, they're bioidentical, and we can write a prescription if it's appropriate for the patient, and they can get them right at their local pharmacies, which is so great. There are also non-hormonal options available. We have a great medication available for hot flashes that's not hormonal, that works very effectively. So that's available to those patients who are just not interested or comfortable taking hormones, or maybe the hormones aren't right for them. There are also other medications that we have available to us that are approved for like antidepressant type scenarios that do work for flashes and low libido. So we actually have a large option of tools in our toolbox to choose from.
How does personalized care improve outcomes for women in menopause?
So menopause looks different for every woman. There's so many different ways they can present with symptoms. Some people have very mild symptoms and they may not need any treatment for hot flashes. They may just be worried about brain fog or sleep disturbance. So when we do a personalized assessment, we see what are the symptoms that are really affecting that patient that they want to deep dive and get treatment for. So then I like to do a check-in every 3 to 6 months with the patients too, because menopause is dynamic. It changes from year to year. So their needs at 50 may be different from their needs at 51. So personalization really treats what's important to that patient, what fits into her lifestyle, and then adjusts as time goes on for the needs that might arise in the future.
Dr. Michelle Murphy, thank you for stopping by today.
Thank you.
Well, as you get older, you need to take different steps to stay healthy. The preventative screenings that you should add to your next doctor visit.
Wish TV. We are local. Spotlight, presented by Community Health Network.
An important step in staying healthy is making sure that you're getting preventative screenings, and which screenings you get depend on your age. To explain, let's go back to News 8's Malia Van Oostrum with Dr. Claire Edelman.
Welcome back, Dr. Edelman. Thank you so much for joining us. What are some preventative screenings for women in their 20s, 30s, 40s, and beyond?
Yeah, that can provide me a lot to talk about. As an OBGYN, I am not only a specialist in the gynecologic system, but I'm also a primary care provider. So I look at every patient as the whole person, right? Not just their gynecologic parts. And so one thing that a lot of people think about when they think about going to the OBGYN is a pap smear, which is cervical cancer screening. And so we recommend starting that at the age of 21. And something that a lot of patients don't know too is that we don't necessarily have to do a pap smear every year. So those screening recommendations change all the time. And so really trusting your provider on those recommendations is key. But for example, for a patient who's had normal cervical cancer screening after, the age of 21, between 20 and 30, if the screening has been normal, we really only recommend doing that every 3 years. But after the age of 30, we start incorporating HPV testing, which is testing for the virus that we know causes cervical cancer. And if that testing is normal, they're negative for HPV and their cells look normal under the microscope, then they can have a pap smear every 5 years. But that doesn't mean we only want to see you every 3 to 5 years. We want to see you every year because we're checking in about the whole person, right? So we also want to do mental health screenings for anxiety and depression. We want to get your vitals and check your blood pressure. We want to talk to you about weight management and healthy decision-making, healthy choices. And we'll talk a little bit more about, all the other screening options that we go through.
Sure. So how does personalized care influence screening decisions?
The American College of Obstetricians and Gynecologists really recommends that we take personal risk factors into consideration when we are screening patients. So we really want to know patients' personal history, family history of different cancers, their history of different other diseases in their family, and that helps guide what screening tests and when we start screening for each patient.
What are the most overlooked screenings in younger women?
In younger women, often it's overlooked to do sexually transmitted infection screening, for example. Another big screening that maybe doesn't occur as often as it should is intimate partner violence screening. We should be asking all patients about that and if they feel safe at home. What else? We also, the mental health screenings for anxiety and depression for our younger patients.
How can women build long-term relationships with their OBGYN?
The most important thing is regular visits. So, starting especially at that age 21 when we're starting those pap smears, cervical cancer screening, but coming every year and really developing a relationship with your provider so that you feel comfortable with them, comfortable enough to share your health concerns, and building that relationship that will go on through the rest of your life, because we don't only see patients for pap smears and for pregnancy, but we see them for their perimenopausal, menopausal transition and everything in between. So seeing your provider regularly is the biggest thing you can do.
Sounds like that's the message. See your provider regularly and you can build that relationship. Well, thank you again, Dr. Edelman. I really appreciate you coming on and telling us about the screenings and preventative measures for women.
Thank you.
Thank you.
Well, sometimes you need surgery, but there may be an option to speed up your recovery.
You're watching Wish TV. We are local.
And welcome back to this Health Spotlight special with Community Health Network. Tonight, we're focused on women's health. I'm joined now by Dr. Sylvia Ertel. Let's talk about minimally invasive gynecologic surgery, or MIGS. Good to see you, doctor. Thank you so much for being here. First, explain what that is and what folks at home should know.
So minimally invasive gynecologic surgery, or sometimes we shorten it to MIGS,
Right.
just means that we're doing surgery through small incisions in the abdominal wall. And the benefit of that is faster recovery time, less risk of complications, and women get back to work and to their normal activities faster.
Who is a good candidate for MIGS?
Really, everyone is a good candidate for MIGS. There really are not very many people who aren't good candidates. There are a lot of different conditions, that would be good for this kind of surgery. Like, most of my patients have abnormal uterine bleeding or problems with pain, like painful periods, pain in between their periods, heavy bleeding with their periods. So, and that's usually either related to fibroids, which is a common condition in the uterus where people develop benign tumors. That causes a lot of problems for women. And we can either remove those either way through these small incisions to remove just the fibroids, or do a whole hysterectomy that way. Even a patient with a large uterus, we can still remove through small incisions.
Well, what are some of the benefits of the minimally invasive surgery? I know you talked about it a little bit, but maybe expand upon that a little bit.
Even with a big surgery like that, someone that has their uterus is very enlarged, if we do it through the smaller incisions, I have patients that can go back to work really in 2 weeks if they want to. And also, these are outpatient procedures. The Community North Surgery Center was the first center in Indiana to have robotic procedures that are outpatient for hysterectomies. So usually the patients go home, even for a big surgery like that, 4 to 6 hours afterwards, and so they can spend the night in their own bed.
Which is, if really for any patient, that's fantastic. For somebody who decides to go this route, what can they expect when they come to the hospital?
So that day of surgery, you'll see your surgeon, and anesthesia plays a big part in this. Usually they'll do an abdominal wall block, and that's one way that we can send people home, relatively soon after surgery. And afterwards, typically the nurses are really involved in this patient care, and they know how to get people up and moving and give them good instructions for going home. And it's the same thing, a lot of it's the expectations that you get in the office when you have your consultation too. We go over to what the medicines that people will take afterwards. We do things to help minimize nausea afterwards and minimize pain afterwards. So your pain, bowel function, urinary function is kind of back to normal sooner. And you can get back to your normal activities faster.
Why is that so important to have that conversation and to be really, the communication aspect of this? Why is that so important for the patient?
Well, I think a lot of people remember like their mother's hysterectomy, where they were in the hospital for 3 days and then had an 8-week-long recovery that was painful, and it took a long time. So I just think people aren't aware, that you can have even more complex surgeries done in a minimally invasive way now. And I think that it's in the past, I've had patients there where they're really scared to have surgery because they remember a family member in the past having this really big procedure, and it scares them into not going to the doctor or doing anything to help themselves.
Information is king. Dr. Ertel, thank you so much for being here.
Thank you so much.
We really appreciate you taking some time.
Appreciate
Thank
it.
you so much for joining us. And that is all the time we have for tonight's Health Spotlight special. I'd like to thank all of our guests from Community Health Network. We'll have the latest news and weather tonight at 10 and 11. Of course, always online at wishtv.com. Have a great rest of your night.